So the first class of alkylating agents that we are looking at is agents that are derived from mustard gases. Mustard gases were used during the First World War as weapons of mass destruction, and unfortunately they're still used today. Part of the observation, besides the acute effect, urtication and damage to the lungs, was that they also cause damage to the DNA. And so scientists start thinking, well, maybe we can use something similar to target actively replicating cancer cells. And using this line of thought, several modifications needed to be done on the molecule. So for one thing, this is a gas, and so it's very difficult to administer. We needed something that would be solid, so would be easy to handle and to dose. And so chlormethadine was first derived using this strategy, where we now have a nitrogen and tertiary amine at the center. The rest is pretty much the same in terms of mechanism. So let's look at what the mechanism is. We have, again, the compound is handled as a solid. This compound is so toxic that cannot be given orally and not even for injection. So it's usually only used for direct injection into the tumor, and causes so much damage to the surrounding tissues if it can permeate to the tissues outside the tumor, that we have an antidote ready to use in those situations. And so ideally what happens is, first we know we have a deprotonation of the nitrogen, so we have free up the base, and that's we are then using the lone pair of the nitrogen to do an intramolecular attack. So, and we form this aziridinium ion, which is the active part. So this is a very strained, highly reactive ring system, and reacts with any nucleophile, hopefully the ones in DNA, but also on proteins, hence the toxicity. And so when upon nucleophilic attack on the here on the rings, we have the formation of covalent adduct, so that's the alkylation process, and that's repeated on the second moiety, and so we have two nucleophiles attached covalently to the central part. So that is the fundamental mechanism, and we'll see that in place with a bunch of different reactivity. And so ideally on DNA, what we'll have is that the famous N5 of guanine will be our nucleophile, and following the primary attack here in the first covalent adduct, we'll repeat the process until we get to cross-linked DNA. And so in particular, this agent is very effective at GA pairs that are facing each other. So from here, however, scientists wanted to decrease the toxicity of those compounds, and so the idea was that we can decrease the toxicity by making that nitrogen less electron donating. And the way to do that is to substitute the methyl group with an aromatic, which is electron withdrawing. So the active component remains the same, but by decreasing the activity, we actually have compounds that can be given orally. So let's look at specific compounds. One is melphalan, which is particularly attractive because it mimics phenylalanine, and so it can be transported into the cells directly by transport proteins that recognize the amino acid moiety here, and for that reason the compound is chiral. Another way of both decreasing the reactivity and also try to target actively multiplying cells is to utilizing the uracil ring. And so we have this uracil mustard, which is less reactive, And also because it mimics a nucleic acid base, it can be concentrated more easily in a cancer cell. It's selectively uptaken. So in cancer cells, we have systems that, basically upregulate the uptake. Another derivative with similar concepts is chlormethidine. And so here we have two groups that I would like you to pay attention to. This is a diuretine, which is electron withdrawing. And that's esterified on one side with estradiol. So the idea is that we have something that is hydrophobic, capable of crossing the cell membranes, and also can target specifically tumors that respond to estrogens. And the other moiety, the active part of the molecule, is actually, the same nitrogen mustard that we have seen before. A very clever method to control the reactivity of the nitrogen mustards is to functionalize them with this cyclophosphamide group, which acts basically as a prodrug. And so this is highly electron withdrawing, and so keeps in check the basicity of that nitrogen. In fact, this lone pair here can be delocalized on the phosphorus and then onto the oxygen. And so the drug actually relies on liver activation by cytochrome P450 type of enzymes. And what happens is that we put a hydroxy group over here. From here we have several possible routes. We can either have alcohol dehydrogenase transforming the oxygen into a ketone group, and that leads to a compound that is relatively inactive because again the phosphate group is the cyclophosphamide moiety is highly electron withdrawing. The other equilibrium here basically involves ring opening, formation of an aldehyde, and the aldehyde can either be oxidized to carboxylic acid by aldehyde dehydrogenase, also giving an inactive compound, or we can have what we call a retromichael decomposition, which is you don't need to remember all that, but what I need you to remember is that we form acrolein and phosphoramide mustard. Now we went from something that was electron withdrawing to something that is actually electron donating, and so this is basically now the active form, and forms the aziridinium ion very quickly, and that basically leads to alkylation of the target. So note that acrolein is also toxic, and so usually this drug is administered with another agent called mesna, which is a scavenger, and we'll see the mechanism in a second. This drug is quite important because there is some specificity, because it needs basically the cytochrome P450 processing in the liver. That means that it can be given orally more easily because it's not going to be damaging the GI tract, and which is one of the common side effects of very reactive drugs. And again, the presence of the toxic intermediate can be released by mesna. So let's see how mesna works. Mesna can work at several stages. So it can inactivate the drug, and so it can serve both as a control, the local concentration of the drug, and also to take care of the acrolein, which is the toxic side product. So from the hydroxy group activation, mesna can either functionalize it and giving something that is quite soluble and can be disposed of, concentrates in the urine very quickly. The other thing that can happen is from the aziridinium, so the active form of the phosphoramide, then we can have action of the mesna and again an activation of the drug. Medicinal also reacts with acrolein to form this compound, which is once again very water soluble and is eliminated in urines. And I should have said also that both medicinal and the acrolein tend to concentrate in the kidney and in the urine. So giving them at the same time kind of ameliorates some of the side effects of acroleins. So the next class of compounds on your book is the nitrosoureas. I'm not going to cover them in detail, other than saying they're very highly reactive. And if you're interested in the mechanism, if you know somebody who has been taking these drugs, then you can look at the mechanism and see how they actually work. It's the same general concept, they just use a different way of generating reactive intermediates. So instead of the nitrourea that we have seen, we now have this compound which is also bifunctional and has a carbocation and a chlorine as a leaving group. Most importantly, we have this kind of alkylating agents called busulfan, which is much milder than the nitrosourea or the nitrogen mustards that we have covered, and rely on the same concept. We have two very good leaving groups simply linked by an alkyl chain. So the mechanism, once again, involves attack of the nucleophile, which here is a nitrogen 7 on guanine, formation of a covalent adduct, then can react once again to form cross-linking structure, and that damage of DNA is what is desired. This busulfan is given as tablets, is orally available, and relatively well. Other compounds also work with a similar concept, and here's a procarbazine. And so they also need liver activation by cytochrome C450 type of enzyme in order to reach the active state. And procarbazine, an example of that, it's a drug that was developed actually for different applications, but it has been since used for anti-cancer therapy and can be given orally. So one of the problems, though, if you think about it, of drugs that need liver activation in order to reach their active state is that they depend on the presence of other drugs that can add as inhibitors or as inducers of the cytochrome P450 system. So that's something to keep in mind. So we are not going to go through the chemistry, don't worry. I know this can be a little scary. All I want to point out is the presence of these enzymes as needed to, basically initiate the intramolecular rearrangements that ultimately lead to all these reactive species that can alkylate DNA. This is another, very similar drug. It doesn't look very similar, but basically what is similar is the reactive methyl diazonium ion that gets produced in both of them, also called diazomethane. Okay, another alkylating drug for which we won't cover too much, other than saying is an antibiotic. And so can be used as antibiotic, as you can imagine. It's so toxic that it's rarely used as an antibiotic. It's also used locally. It's used in bladder cancer. It's used also in the treatment of glaucoma to kind of prevent scarring. And the active component is over here. So again, don't worry about remembering the chemistry. What I want you to remember is that this is the active site. And also that, after the first reaction, right? So after we have the formation of this first adduct, we unmask a second reactive group, an urethane, that can further react. And so finally we get cross-linking on DNA. So this, even though it doesn't look like it, this is a bifunctional molecule. Okay, so to conclude this part, the alkylating agents, we'll review quickly. Alkylating agents used in the chemotherapy. And the reason I want to do that is, we tend to forget that what we are studying in class is actually incredibly relevant to what happens in the practice. And so we talked specifically about these two very similar compounds, and we didn't cover lomustine and carmustine specifically, but I want you to note all the nitrogen ureas, right? Chlorambucil is used, as the name says, is used for leukemia, so leukeran. Other drugs, we won't go too much into the mechanism of action, but the other one we covered was busulfan, which is the one has very good leaving groups that are kind of not too reactive and not too toxic. So the last class of agents that modify covalently DNA is based on this compound called cisplatin, which was discovered serendipitously when examining E. coli solutions. And so, in other words, it was first discovered for its antibacterial properties. And then, because it was not to damage DNA and cross-link DNA, it was applied to cancer therapy. So it has some level of specificity because it likes N7 and guanine, and so that's where it tends to concentrate. It forms intrastrand links, and we'll see that all is initiated by these two groups. And also, the way it works is by changing the local structure of DNA, preventing the binding of enzymes that replicate and transcribe DNA, and so prevents their recognition. It also prevents the recognition by enzymes that repair DNA, and so that's part of the toxicity. So these compounds are extremely toxic. They're administered in infusion by IV. The whole process takes a few hours. They have severe toxicity at the peripheral nervous system, and so with tingling and other neuropathy, that loss of sensation, feeling of numbness, tingling, and also a very peculiar side effect. And so patients who are taking drugs in the cisplatin family basically cannot touch anything cold. They perceive the cold sensation as pain, and that's due most likely to the action of cisplatin on a particular ion channel that is usually a sensor for temperature. And so there is a kind of crosstalk in a way, so that any cold sensation becomes painful. And so these are also very common drugs to use in the treatment of solid tumors like ovarian cancer, breast cancer, colon cancer, testicular cancer. The first one, cisplatinum, was started to be used in 80s. And so we have a very good data on the toxicity and the tolerance. In general, the main toxicity is also the long-term neuropathy and also the loss of hearing. Those are monitored very carefully. Other side effects which are common to all chemotherapeutic agents are emesis and GI tract problems, and those can be controlled with adjuvant treatments. So let's look at the mechanism of action. There is some selectivity of cisplatinum in getting into the cell because of this particular reaction. So what happens is that from the bloodstream, cisplatin gets into the cell, and here it undergoes a reaction called aquation, which is due to the fact that chlorine is less concentrated inside the cells than it is outside cells. So that's the first step, and that's the activation step, and somewhat traps the compound in the intracellular component. From here, we have reaction with a nucleophile, typically DNA, but can also be thiols, such as those found on proteins, from cysteine side chains or on glutathione. And I should also say that organoplatinum compounds tend to bind very strongly to the circulating carrier proteins, so albumin and so on. And because of that, they tend to stay in the system for months. And so the true toxicity of these compounds is often not found for a specific patient until months after cessation of treatment. So anyway, starting from here, we can have several reactions again that result in the cross-linking of DNA. So other analogs have been developed using during the years that are somewhat less toxic, and one of them is carboplatin. This compound was orally active, but it's not used very much anymore. One of the favorite ones is oxaliplatin, which is used quite commonly. The toxicity is a little less than cisplatin because of the presence of these chelating groups, basically, that coordinate the leaving group. And what else? The other thing I wanted to show you is the structure of platinum cross-link in duplex DNA. So that's the origin of the activity. And so here it is, this platinum ion here in red in the structure. So we have this point change that changes the structure of DNA, and again prevents its recognition by transcription enzymes, but also other enzymes that remodel DNA. It also prevents, of course, the separation of DNA, double-stranded DNA, into single-stranded DNA. So with that, we have finished discussing agents that covalently modify DNA, and I want to make sure that we kind of summarize what we've seen. So we've seen the nitrogen mustards, and should be able to recognize their pharmacophore, right? We have seen prodrugs like cyclophosphamide, for example, that contain the same functional group but gets activated only upon metabolism by cytochrome P450. And then we have seen compounds like the cisplatinum that again are bifunctional and result in methylation of DNA, and so chemical alteration that produces basically toxicity, especially on cells that are highly replicating.